and welcome to The Beauty Shaman. So today I have decided to interview a woman whose makeup had the great privilege of making her up, I guess I should say, on a television show recently, where she talked about her experience and her great wealth of knowledge as a functional medicine doctor. Her name is Dr. Jill Carnahan. And one of the things there's many things that fascinated me about her, but one of them is she has a skincare line. And she gave me some of the products, thank you, and I've tried them and I'm very impressed with it. So I'm interviewing Dr. Jill in particular about the ingredients in her line, why it's so effective, and what made her choose to create this line. So thank you, Dr. Jill, for joining me today.
You're welcome. I'm excited to be here.
So can you explain to the audience what is a functional medicine doctor? This is sort of a new area. I don't know how many people are aware of functional medicine. What is that and what got you into it?
Yeah, so functional medicine. So first of all, I'm an MD, a regular medical doctor, and I trained in family medicine. So I treated all ages, delivered babies, and really the whole full span of our lives, our full lives. But what got me into functional medicine is I wanted to really be a healer and get to the root cause and not just treat symptoms with drugs and surgery, which have an appropriate place. I always say if you have a heart attack or you get in a car accident, the very best place you want to be is in a conventional emergency room. There's no other better place for you. But what happens is nowadays with our chronic illness, with our diabetes, obesity, toxic load, and all of these things, medicines aren't the best treatment. So what I do is look at the genetics, the metabolic pathways, the biochemistry, the physiology, and I say, well, how did you get here? So rather than just stop with the diagnosis, I ask the question, why? I'm like a medical detective. And then we go deep and we dig and we say, well, something brought you to this point, and how did you get here, and how do we reverse disease instead of just slapping a Band-Aid on? So I'm like the medical detective. If you ever watch the show House, that's kind of what I do in clinical practice. And so I love to solve mysteries and try to find out ways to reverse illness and get people back to an optimal state of health. And then I do have a little personal story I would be happy to share.
Yeah, how you got into it, right? Yes.
Yes. So I was in medical school, in third year medical school, 25 years old, found a lump in my breast. And I did not think anything of it because 25-year-olds, are invincible. It was in my surgery rotation, but at the insistence of my husband at the time, I got it checked out. And within just a week or so after the biopsy, I got a call and found out that I had a very aggressive, invasive breast cancer at 25 years old. I remember I'll still always remember the place I was sitting when I heard the news and just not knowing if I had 6 weeks or 6 months or 6 years. And many of you have people, maybe even yourselves, you've experienced breast cancer. I think there's probably not a person listening that hasn't been affected in some way. But the interesting thing is at 25, young women who are diagnosed with breast cancer, the mortality rate, the death rate is much higher because typically in a young woman, it's a very, very aggressive disease. I was no different. I was in for the battle of my life. And I was in a group of young women. We were all under 40 in Chicago, Illinois at the time. I'm the only one still living. So
wow,
I'm a miracle.
Oh my God.
Yeah. But anyway, I did chemotherapy, I did radiation, I did surgery. But what I also did was I learned nutrition and I learned lifestyle things. And I actually feel like the cancer was an easy battle. I hit it with all those really strong things and I survived. But the next 20-year journey was how do I restore vitality and function and recover from the therapy for the cancer, which I don't regret at all. I did the right thing because I'm living and surviving and thriving. But what I had to do then was rebuild my system. And one of the things that's relevant to today's discussion was I realized I grew up on a farm with lots of toxic chemicals. That was a contributing factor to my breast cancer at an early age. And part of the factor was the things I put on my face and my body and my makeup and my hair products and my cleaning products. So what I did about 6 months after my breast cancer and recovery, I realized the toxicity of the products that I was using in my house and on my body. So I did a deep dive. And I always say, when you first realize the toxicity of some of these products, It took me several years to completely clean out every product, and it's not cheap. As you know, it took me
Oh,
some
I
time.
know. It's very expensive. I've done it. It's, yeah, it's a huge thing.
But learning what chemicals, phthalates, parabens, how all these things affect our bodies, and how our young women especially are putting these on their lips and their face. So I'm extremely passionate about your platform and what you're bringing to all ages. And one of the reasons why I'm here to talk today, because I realized what I wanted was really amazing products that worked, but that were non-toxic. And that's actually hard to find, isn't it?
It is very hard to find. And I'm always on the lookout for those kinds of products. And you need a very special, you really need to be specialized. Like, it isn't something that you can go to one of these big houses. We were talking about camera about this and say, hey, just put some vitamin C in it, a little hyaluronic acid, and we'll slap a label. This takes thought, and it takes a chemist, and it takes input. And I think what you've done is so fascinating, because you were telling me off camera, and maybe just talk about how this was formulated, how you came to this.
Yeah, so we originally started some skincare products where we had a company that would manufacture and then we put our label on it. They were okay, but there was still times when I'd get a bottle, I'm like, I don't like this ingredient. I don't want this for my patients. And actually more often than not, there would be bottles and there was, say, half or three-quarter of their line that I would not put my name on because there was something like a phthalate or a paraben or an SLS or something in there that I did not agree, that I did not want on the body. So this product we're going to talk about today was kind of a combination of two things. One was, I love N.A.D. N.A.D. is nicotinamide riboside. It's a precursor to our ATP. And what I found is it can be IV, it can be subcutaneous, it can be oral, and it can be topical. And I started using a compounded, just very simple N.A.D. cream from a compounding pharmacist. And I was like, wow, I had used retinols, I had used all kinds of other products on my skin. This N.A.D. was like phenomenal. I'm like, there's something in here, and it's the N.A.D., of course. And I said, we need to create. So what I was telling you off camera is the original product that I tried from a pharmacy had aluminum in it. And so I said, no, this is not going to work for my patients. So I had to really create from the ground up a product. We actually have two, a serum and a cream, and that can, number one, contain that powerful N.A.D., which is, again, is a precursor of every cellular energy currency. So repair, DNA, rapid division, and collagen production, hyaluronic acid, all of these things. It's like a key ingredient in making those things happen. But then what we did is we added some cool things like peptides that increase collagen production and hyaluronic acid, epidermal growth factors. And what we did is made the base completely clean of anything that I would consider toxic.
And you made this yourself. Like, this was you and your friends formulating this. This is, every single ingredient, and you know how it's made, and you are super in line with it, which I think is very unusual. I don't know if the audience realizes this. For the ladies watching, this is rare. Okay. I look for these kind of lines. And seriously, like, I would say 95%. I don't know. Do you think, Dr. Jill, it's pretty accurate? 95% of the stuff on the market, this is not the case. So what Dr. Jill has done is actually very difficult, very time consuming. It took you what?
At least 9 months, maybe longer. And I want to give credit my partner, Dr. Eileen Naomi Russ. She was an equal partner in all of this. So she's a neuropsychologist. So it's kind of a really cool combo. I'm a medical doctor. She's a PhD. So we're both doctors, Dr. Russ, Dr. Jill, but we partnered together. And yeah, 9 months or longer of investigation, of trial and error on our own skin. And we'd have friends, we're like, try this out. What do you think? And the texture, and then, because a lot of those things that are parabens and phthalates, they make it softer or creamier or soapier or foamier. So they actually have a reason, but they're not healthy for our bodies. So we had to get a product that worked, that felt good on your skin, but that had no toxic ingredients.
And this is an interesting point. I don't want to caveat too much into this, but I think a lot of times when we as women are looking at products, we so quickly, and this is your product, I'm just using it as a demo, we go, smells nice, feels nice, oh, it's great. As opposed to, no, that's not an indicator. That's something nice, but it's not an indicator. What is an indicator is the deck, right? It is the ingredient deck, and it is the order of ingredients on the deck, right?
Yes, absolutely. And it is actually non-scented, and then the
I
serum.
noticed that. I just smelled it. I'm like, oh, it's,
yeah.
It smells.
There's no, we chose because we could have put like a rose or a lavender, like something essential oil, but we're like, you know what, let's do it because I treat the most sick of the sick patients, the chronic, both like mast cell activation, which is this thing where people are really reactive, or multiple chemical sensitivity, where every smell, any detergent, even natural essential oils can bother my patient population. So I wanted something that even the most sensitive patient could tolerate and actually benefit from. And, you know, we talked earlier, I love how you talk about aging. I want to age well. I'm not against, I want to go into my 80s and 90s without any sort of, you know, surgeries, procedures. I want to be vibrant and healthy and love my own skin and be glowing. And how do we do that? Well, we do that with the foods that we put into our body, the water that we drink, the air that we breathe, and the products that we use.
So what do you think? This kind of leads me to one of my questions. And so, you know, I think we talked a little bit in the green room when I did your makeup, but I've been doing peptide injections now for about a month and a half, and I've lost 7 pounds because the ones that I'm taking are specifically for weight loss. Again, that's a little caveat. I don't want to go there, but what I've learned is, wow, these really work. This is really fabulous. And I'm a firm believer in internal, right? Like really taking care of your internal body. I believe in supplements and, you know, as well as external this, and then your thoughts, right? It's what you think as well. But what for you is the, I guess, percentage points, right? Because you're dealing with the internal side of people, but then obviously you want to age well like the rest of us, and you obviously are. So what is kind of the percentage points as far as this is the half that, you know, you need to get these peptides, these N.A.Ds, these really great ingredients that are so valuable externally, and then also getting them internally, right? Because you can, I'm like me, I'm taking the peptides internally.
Yeah.
So what's kind of the separation, the percentage rate on those things?
Oh, I love that you said this because I already, since my cancer, which is 20 years now this year, I'm just about 45. I'm only 44 today, but I will soon be 45. And so all of these many years, I have eaten super clean. I care about everything that goes in my body. So organic if possible, no pesticides, homegrown or close to local if possible, avoiding the super toxic foods like farm salmon or things that have PCBs in them. So all those things were a given. And then I move every day. I pray and meditate every day. I do a lot of those things. So to me, this is like I want to be an optimal performer. So I always say, I love this. You'll love this too. Yeah. It's okay to be high maintenance if you're high performance. Right. So like if I'm traveling to a conference on the weekend when we used to travel, I would take 2 bags, and it wasn't all shoes. It was like a blender and an air filter and like some clean, peptides and food. Like I would take a lot of stuff, but I always joke, I'm like, it's okay to be high maintenance if you're high performance. So these are the kind of things that I think take us to the next level. So 80% air we breathe, I always say clean air, clean water, clean food. That's 80% foundational. But most of my patients, and you and I, have that down. So then how do we glow like, someone half our age without anything that's, surgical or chemical or extra? And that's where these things take my performance to the next level. So I can have the performance of whether it's incredible deep sleep or great brain focus, concentration, clarity as I'm talking to you, or skin that looks healthy and glowing and moisturized without anything synthetic or surgical or any of those kinds of things. And so this is kind of that last 20% that gets us to that next level. And for me, I want to be in the top 1% in performance, in appearance, in youthfulness, in energy, and all of these things. And so I think it takes sometimes these kinds of nutrients and applying it to the skin. So many medications now that are getting new patents, they're transdermal. So our skin is a great organ for nutrients, and this is full of nutrients. It's got antioxidants. It's got the N.A.D, which is the main ingredient. It's got epidermal growth factor, which causes promotion of cellular proliferation, enhances like collagen production and all that. So it's almost like if we had, Botox, except we don't need that.
So which one of these is the like you said is like that? Like it plumps up the skin? Is that the serum?
Yes, so the serum actually has the epidermal growth factor, and you've got the sample. This is what the full
My
bottle
little,
looks
I
like.
love my little samples.
Yeah, I'll get you a big one here. So this is the serum, and I like it. It's lighter for you. I think the thicker cream is really good for as we age. We get a little more dry. We don't have quite as much elasticity. So any age can use any of these. But I find that the women over 40 like the cream a little better, and the serum any age. But you can use them both. This one has the epidermal growth factor, and this one has some other ingredients like the peptides. So they can be used together. I like the serum in the morning. It's a little lighter. And then I like the cream at night because then all night you get that moisturizing, thicker ingredient.
Now you also gave me a cleanser, which I love, by the way. In fact, I didn't even put it, it's still in my shower. But you also have a collagen booster. Why don't we talk about that, the HA collagen booster? You've got
Yeah,
hyaluronic acid in
yeah, love. That's another favorite. That one is just light and moisturizing. It feels like silk on your skin. If I had to pick one of my favorite ingredients, it's hyaluronic acid,
I
besides
love.
N.A.D, right? Because you can't get enough. And I'm in Colorado, so are you. So it's the dryness out here. I always go, like if I go to Miami or LA or whatever, all of a sudden my skin is like it looks really plump. I'm like, wow, that Colorado really dries us out. So I love for Colorado, especially in dry climates, the hyaluronic acid. And you could use that. I actually use that one morning and night in addition to the N.A.D.
And it has an immediate effect too. I think I love hyaluronic acid. I put it on people sometimes when they sit in my makeup chair because if I can, like a lot of people show up with foundation on, I can't do that. But if I can, I do because immediately they plump up.
Yeah.
I love that. So I think that's great. You've made that. Okay, let's move on. The Radiant C Cream. Let's talk about your Radiant C Cream.
Yeah, so a lot of people just want like a general moisturizer, and that's one I use for like neck and this area because it's really nice for if you had a big bottle, you could put it all over your body. But vitamin C is just yeah, I know, right? It's just a great antioxidant. It's really, really nice to brighten your skin. So if you have any dark spots or aging spots, I love the C cream. And then there's a serum too that just brightens up that surface and you get a little less of the pigmentation. And again, Colorado with this bright sun, and we're very prone to sun damage here too.
Well, we are, and I think in other parts of the country too, and age spots. I mean, I use sunblock every day, and I still have age spots that I'm, been working
Me
at.
too.
I don't ever look at it negatively, like we talked about. I think I love my age spots. I give them love when I look at them. I
Me
don't go,
too.
oh man, I go, I love you. Okay,
Yeah.
get rid of you. You know what I mean?
Exactly. We love you.
I love you, but here you go. Yep. Okay, so I think the last thing I want to mention that you gave me was the Vita CE with I don't have my glasses.
Ferulic acid. Yeah. Okay. That one I think is so the C cream that we just talked about is a little bit more like you could put it all over. It's very moisturizing. It's a cream. It just has vitamin C in it, really basic. And really, if I have someone who's sensitive to everything out there, the C cream is the one that I'll choose because I don't have anyone that's ever really had a reaction to that. The Vita CE serum is kind of like a potent version of that because it's got vitamin C, vitamin E, and ferulic acid, which is actually even more powerful for brightening and lightening. So instead of using the synthetic brighteners and lighteners, which there are medical, grade types of synthetics, this vitamin CE with ferulic acid is really great for lightening and brightening the skin, and more powerful than the C alone.
The thing that I've found is that the ingredients that they use in those lightening products, and I used to know the actual word of it, are terrible. They directly link to cancer, right?
Yes.
Right.
A lot of them have steroids. So steroids is one, and then hydroquinone. I was trying to remember the name. Hydroquinone. Yeah, not a good product. I mean, and what you've probably seen too, this is hair care too. There's these products that really work and they're toxic. So what I keep wanting to do is how do we find stuff that really has the power of the synthetic garbage, but has no toxicity? And so that's where, like, I think on this N.A.D stream, we're starting to find some powerhouses that are not only non-toxic, but good for our bodies.
And I love it. And that's why I'm excited about N.A.D. I'm actually going to try N.A.D intravenously. That's going to be my next project.
Oh, you will love it.
I've heard. Regina, actually, a mutual friend of ours, tried it and loved it as well. So that's my next thing, because the peptides I'm totally into. I'm just seeing what that does, taking it into now taking it externally. And I think these are such powerful ingredients for older women to really hone in on. And, you know, speaking directly to the audience now, I mean, I feel like, ladies, this is such an important thing for you to check out. And so I really want you to go to Dr. Jill's website. So Dr. Jill, your website is it's drjill.com. Is that right? Or
So
Dr.
there's two websites. If you want just blogs and information, it's all free. Just my name, jillcarnahan.com. So you can go there anytime, all free. Please sign up for my newsletter. It's all free. You get free content every week. I write articles about stuff like this. The second one, though, for the products is drjillhealth.com. So drjill, Jill, health.com. And we made a special coupon just for your listeners. Do you want me to share that?
Yes, go ahead.
Okay, so it's SB Beauty with your initials, SB Beauty. There's two B's, and you'll make that available for a week at least after this is aired live. And everybody who uses that will get 10% off of any of these products.
Awesome. And I think it's worthy to you know, go to those websites and really look at her material. I love that you have such great free material for people to really learn. And I'm all about learning as a, you know, as a mature woman. I am so, man, my life is not half over. It is like halfway begun.
I know. Amen.
I have so much to do. And I believe so many of you out there listening to this are this way too. I love aging. I love getting older and I love learning. And so this has been so informative. I'm so grateful for you coming on, Dr. Jill, and talking about all of these things.
Thank you for having me. I love it.
So ladies, please check out Dr. Jill's websites. I will put them in the drop down below here on YouTube. And if you have any questions, you can email her, email me directly and ask questions, but please check out what she's doing. I think it's wonderful. And this is definitely the future of skincare and medicine. So if you're haven't heard of functional medicine, you know, definitely look into that. I'm all for these types of treatments. So thank you so much for watching The Beauty Shaman, and, you know, best of luck to everyone. Stay happy, stay positive, age well.